Hello and welcome to a new episode of Science in Context. I'm Ryan and this week I'm joined by Dr. Thomas Rawson and Dr. Natsuko Imai to speak about measuring the impact of delaying the interval between first and second doses of COVID-19 vaccines. Tom, how did the shift in vaccine timings impact the pandemic in England?
Hi Ryan. So when the vaccine rollout first began, the original plan was to have a 3-week delay between your first and second dose of the vaccine, starting with the older and more vulnerable groups of the population. But in light of the Alpha variant, this decision was changed, and we instead had this 12-week gap between your first and second dose. And what our study does is look back at that decision and consider and compare the what-if scenario of what if we had stuck with that original 3-week delay. And what we found was that the approach we did take, the 12-week gap between doses, allowed a greater number of people to have their first dose and therefore this level of partial protection from the disease, which in turn acted as a sort of buffer to prevent the disease getting through to those more vulnerable groups. So the benefit of getting out as many first doses as possible outweighed the benefits of prioritising the second doses to the more vulnerable. Our study found that the decision we took, 12-week delay, likely prevented tens of thousands of hospitalisations and over 10,000 deaths from COVID-19.
And Natsuko, what did the findings tell us about changing strategy during a health emergency?
Sure, so our study really reinforces the principle that evidence-based practice is critical for decision-making, especially in health emergencies. And this decision to switch to a delayed dosing strategy was based on early evidence of a high level of protection from a single dose and the emerging threat of the Alpha variant. And so our analysis really highlights the importance of adapting health guidance when we have new evidence, and that continuous surveillance and reassessment is really crucial. And finally, it demonstrates how mathematical models are really useful to bring together lots of different types of data to really quantitatively and systematically assess all of the evidence together.
Thank you both for your time.
Thank you.